Let's start with that question about the flu versus COVID for kids. Which is more dangerous?
So this is US data, and look, I'll preface this by saying that very few children have died in Australia. I think it's single digits, and they've been kids with other complications. The United States gives you a better idea, unfortunately, because COVID ripped through the United States in huge numbers, so you can see the effect of that. And when they compare the number of deaths from, and it's still low, even by US standards, but and they compared it to the historical average of deaths per year of children. And people do talk, and it's true, that children are quite vulnerable to influenza. It's important they get immunised, and they are at risk of severe disease. COVID-19, even when you allow for different age groups, is significantly more risky for kids than influenza. So it points to the notion it's still rare, not something to become panicked about, but people are saying, well, why should I get my child immunised against COVID-19? Well, we're immunising our kids against all sorts of things which are relatively rare in the community at the moment, largely because other people are vaccinated. Yeah. But it's an argument for really getting your child immunised when it becomes available for your child's age group.
Well, just remind us the age when kids can be vaccinated.
I mentioned that before I walked in, so I can't remember where we are with really young kids, but 5 to 12-year-olds are now eligible. I should have just gone a blank on younger kids than that, but that's on its way if it's not there already.
So another study has been looking at long COVID, and in particular its immune signature. Now, what's that?
Yeah, well, the problem with long COVID is you want to be able to diagnose it accurately when you start testing treatments, because how do you, for example, with Alzheimer's disease, it's been a huge problem in treatments for Alzheimer's disease. How do you know somebody's actually got Alzheimer's disease? So if you give them a drug, they're getting a benefit or not. So is there a signature which gives you a diagnostic picture? And there's growing evidence that maybe there is. Some white blood cells change their pattern. Antibodies to COVID itself changes pattern. You might have antibodies to Epstein-Barr virus, the glandular fever virus. And there are also other signatures that have been found by other studies. Some of these studies have yet to be peer-reviewed. The good news is a kind of pattern is evolving that you might be able to diagnose it, which means that when you start trying treatments, you're actually treating long COVID, not something else.
So there is a treatment for long COVID?
Not yet, but there are lots of trials going on. The Americans have poured in a fortune into this area. So hopefully some of that will bear fruit. And interestingly, it could bear fruit for people with chronic fatigue syndrome, because there's clearly an overlap here in terms of the response to the virus.
So another study that's come out on how the various variants of COVID spread through fine aerosols. So these are basically the tiny droplets that are carried on the breath.
That's right. So the study of fine aerosols and the viral shedding, and what they've shown is, first of all, fine aerosols are much more common than large droplets, which really does call into question the 1.5 metre thing that we got obsessed with during the pandemic. And what they showed was, bottom line, that each variants, the variants since the ancestral variant from Wuhan, do shed a significant amount more small viral particles, with maybe a trend towards Omicron producing even more than the other ones. But the point is, as the virus has evolved, its ability to exude fine particles has increased.